Chapter 1, Anatomy, Physiology, and Disease, Learning the Language. This is the first chapter on our journey through body systems, diseases, and drugs. Please review the learning objectives at the beginning of the chapter. Also, at the beginning of the chapter in your book are the key terms. As seen here, there is also a pronunciation guide. I will go through these terms: anabolism, anatomy, catabolism, diagnosis, disease, epidemiology, etiology, exacerbation, homeostasis, idiopathic, macroscopic anatomy, microscopic anatomy, metabolism, morphology, nosocomial, pathogenic, pathology, physiology, prognosis, rhinoplasty, and syndrome. Part 1. What is anatomy and physiology? It's important to understand the terms associated with studying anatomy and physiology. Anatomy is the study of the internal and external structures of the human body. Physiology is the function and the vital processes of the structures that make up the human body. Anatomy basically comes from a Greek word, but it's about how the body's put together or organized. Specialties in the field of anatomy, we either have microscopic anatomy or macroscopic anatomy. So microscopic, think microscope. So that means very, very small. Can't be seen with the naked eye. We need magnification, like a microscope. So that would include things like cytology, which is the study of cells, or histology, which is the study of tissue samples. Whereas macroscopic anatomy, which is also known as gross anatomy, is something that you can see with a visible naked eye. So that would be a skeletal system, looking at an X-ray, describing the makeup of a hand and the bones located in a hand, for example. Now, physiology, although closely related to anatomy, it's the study of how the anatomical structure, such as cell or bone, would function. So physiology is about the function. It deals with vital processes of life, and there's lots of subspecialties. So anatomy focuses on the structure and how something is put together, where physiology is the study of how those different structures will work together to make the body function as a whole. Design of the structure is often related to its function. So if we think of how a joint works, so the design that it can bend, but its function so that we can walk. So we would look at that. Human anatomy and physiology, or what's commonly known as A&P, forms the foundation for all medical practice. Medical treatment attempts to bring the body structure and function back to the normal anatomy and physiology and how it operates. Now, as we're going through this course, and as we prepare for pharmacology, it's very important that we understand how the body is put together. We also need to understand how it functions normally and what happens when it's not functioning normally, when it malfunctions, when it is in dysfunction. When we have that comprehension, then we can understand how medications can be used to return the body to its normal stasis. All right, so let's talk about some terminology in the studies of the human body. So, study of body function was